Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio, and delighted to be back with you this morning. Man, there is some good news out there today. We're excited about that. Both the vaccines arriving in Kansas, and then great news about Moderna. So that means even more vaccines are going to be arriving in Kansas. And we have two very special guests on the line we're going to be visiting with shortly. But first, how are we?
Hi. You know, our numbers are still high, 165 total patients. So 87 that acute active infection phase, with 55 of those in the ICU and 26 of those on the ventilator. So still 78 people in that kind of post-acute infection that not really recovered, but in that recovering phase. So the numbers are still pretty high, taking up a lot of capacity and a lot of bed space. In Hayes, they've had a slight increase in their numbers as well, 30 total patients with 26 of those in the active phase and 4 in that recovery phase.
So I'm hoping that the drop in the number of acute inpatients is a good number. I saw the number in Kansas City yesterday. I don't know how many tests were done, but only 660 or so new positive cases, which is lower than it has been for a number of days. So, and that was on a Monday. So, actually, that would have been Sunday's data.
Trending down. It is trending down, though, which is overall, really
that's good. Well, we are joined today by Kansas Governor Laura Kelly. Governor Kelly, thank you so much for being here. And Secretary Dr. Lee Norman, Secretary of KDHE, Dr. Lee Norman, and a former Chief Medical Officer here at the University of Kansas Health System. It's always a delight to have Dr. Norman with us. So, Governor Kelly, let's start with you. Thank you again for being with us this morning. You must be excited as the COVID-19 vaccine is starting to roll out in Kansas.
You know, Dr. Stites, I was actually thinking about, am I excited or am I just relieved?
Yes.
I believed that we are really truly turning the corner now on this virus. And, we should expect, as more and more people get vaccinated, that we will, and I know it's going to take a number of months to get sort of the general population done, but, we really should be seeing the number of cases going down and, in number of months, our ability to really reopen our businesses and get our kids back into the classrooms. So I'm excited about that. And I think, the first shipment of the Pfizer vaccine came in yesterday. It's already spread around the state of Kansas, and wider distribution will continue now through the course of this week. And vaccines have started. It'll ramp up considerably tomorrow and the next day. So excited about that. We've got Moderna coming in, as you said, next week, about 49,000 doses of that. We expect that to be accompanied by another shipment of Pfizer. So, it's on. The vaccine is coming, and we will be able to start taking care of folks. You and others like you who are frontline healthcare workers are first in line. We have to make sure that our healthcare workers stay healthy so that they can take care of the rest of the folks who are not. So we'll get them done first, and then we'll also be working on our long-term care residents. Those are the phase 1 groups, and we're working now with our internal and external advisory groups to determine how we sequence the rest of the vaccinations. Obviously, we need to get to our essential workers. We need to get to our elderly population. We need to get to folks in the population with comorbidities and so on. So we're working out the strategy for that over time. So we should have that done by the end of this week, beginning of next. So that's where we are. From my perspective, and now I will turn it over to Dr. Norman, see if he's got something to say in some perspective.
Hey, Norman.
Thank you, Dr. Stites. Thank you, Governor Kelly. Let me just amplify a few things that the governor talked about. We are seeing a leveling off a little bit of the numbers in hospitals, as you know, which is encouraging. We still, yesterday, from the prior Friday, had over 4,000 new cases and 37 new deaths. So we obviously have a lot of work to do, and part of that is the very exciting prospect of what the vaccine is bringing to us. The vaccine has arrived at 2 of our hubs, and should be today the additional ones. Again, it's kind of a hub and spoke, as the governor pointed out. whereby the hubs will receive it and then we'll push out to the various points in the state. And there'll be a lot of places receiving the vaccine even this month. It's not just hospitals, but it'll be local health departments, local pharmacies, and potentially even EMS providers. So there'll be a fairly wide distribution base. The guidance for who gets it will be, as Governor pointed out, the very essential people this first month. And then it'll really take some number of months over time to really fully distribute to all the people that cascade through the various priority groups. And there's always a little controversy with that, as you know. Healthcare providers, particularly those taking care of COVID patients, long-term care, and other kinds of healthcare providers that are seeing patients will be, prioritizing obviously essential workers, teachers and the like, and we'll be rolling that out here very soon. The external advisory group meets today. We want to keep in compliance with CDC guidance and the Advisory Council on Immunization Practices. A couple other things, realistically, we still need to and are rapidly ramping up the amount of testing we're doing. We brought on in the last 10 days 23 additional testing sites. 15 new ones will come on this week. And additionally, there'll be the program you've probably seen advertised, the Stop the Spread campaign, and the gogettested.com/Kansas website will help people access testing at no cost to them. Last opening comment is holidays are ahead, and we saw an uptick after the Thanksgiving holiday, and I hope that with the December holidays that people show some restraint, wear masks, socially distance, and the like. I know you are going to do that admonishment, Dr. Stites and Dr. Hawkinson. So that's the end of my opening comments.
It may come out. What's fun about this is, and Governor, I loved your comment, game on. We have been playing defense for the last 10 months, and now we are going on offense, and that feels good. So talk a little bit for just a moment about how you expect to go from healthcare, frontline healthcare workers to nursing home residents, and then general Kansans. How are they going to get vaccinated? Where are they going to get vaccinated? When do you think that's going to start?
Well, like I think Dr. Norman just said, it's going to take us probably the first month or so to get through the frontline healthcare workers in our hospitals and our long-term care facilities. Also, remember, we have medical facilities in our correctional centers, so we've got to take care of all those folks. We absolutely have got to vaccinate our long-term care residents. We know from historically that the death rate is the highest in those kinds of facilities, so we've got to do all we can to protect those folks. So we'll do that. Then when vaccine doses allow, we will move next to the essential worker category, which we're in the process right now of really setting those out. Who will be considered an essential worker, and in what sequence will that category get? I expect that we will be getting to that sometime in January. We'll start there, and then again, as we get the supplies, we will move it out. I expect that while everything hasn't been set in stone yet, we will move from essential workers really to our over 65 population. Concurrent with that, we would do people with underlying medical conditions that put them at high risk, and that I expect will take us into the spring at some point, and then when we're looking probably at late spring, early summer, when we move out to our general population. I think people also recognize that right now there is no vaccine for anybody under the age of 16. So we are anticipating that that could come online, and once we have a vaccine that's appropriate to administer to children, they'll be put in the queue.
And Dr. Norman, how do you see the general population actually getting vaccinated? Will that be through their primary care physician's office, a clinic at Walgreens, drive-through clinics? How do you think that's going to come together?
Yeah, it's a great question, Steve. Well, first off, the Operation Warp Speed and the really conceptualized the distribution model being that there would be vaccines sent to about 5 hubs, and then people would go to those hubs. Well, that might work well in Washington, D.C. or Maryland or something where you don't, small states geographically with dense populations, but that won't work here. And so we've had to construct our own model. It's been approved by the CDC in Operation Warp Speed. Matter of fact, we have somebody from CDC on site here with us to help us with just additional resources. But there'll be, we have a lot of people that are registering to be vaccinators, and the vaccinators can be hospitals, clinics, can be FQHCs, the Federally Qualified Health Centers. So there's pharmacies can do that. As the governor pointed out, long-term care and nursing facilities are high priority. We have a real tight partnership with CVS and Walgreens that'll push out to about 70% of the nursing home patients. So I think that a little bit of this will be worked out as we get farther into the, probably in the springtime realistically, but early on there will be, and as soon as next week, we're pushing out to local health departments and FQHCs. So that's right there is a fairly broad coverage throughout the state. Yeah, that's my answer.
Like we said, going from defense to offense. Jill, let's see what reporter questions are out there.
Good morning, guys. It's Taylor at Channel 41. How are you this morning?
Hi, Taylor. Good.
I hope you'll bear with me with the governor and Dr. Norman on the line. I have a couple of questions that I hope you can answer maybe in one string of answers. One, we've obviously talked to a lot of people that were involved in the trials for the vaccines this year leading up to this. We had a viewer question ask, what if they don't know, if they were involved in the trial and don't know what they got, is it okay when they have their chance to go ahead and get either of the vaccines, assuming Moderna is approved, either of the vaccines once they're able to do that? Is it okay to go ahead and do that? Second question is, obviously the goal is that everyone will take this vaccine whenever they have a chance to, but with people in long-term care facilities being at the top of the list, what availability, what option, what's going to happen there for people who live in those situations who decline to take the vaccine for one reason or another, choose not to do that? What is the protocol? Do we know what that's going to mean for people who live in those facilities that do not wish to take one? And finally, if the governor wants to answer this, especially, do we know, I know she mentioned school children, but is there any updated hope or goals for the rest of this school year leading up to May to finish out this school year of how this development may change what the school year is going to look like for the rest of the 2020-21 school year? Thank you.
Okay. And Taylor, your first question, say it real quick.
Can people get a vaccine if they were part of the trial and they're not sure what they got? Is it safe to go ahead and get one?
Dr. Norman, I think, I know I have an answer to that too, so.
That's not our call. We'll vaccinate anybody that was involved in the trial. But they have an agreement with the manufacturer, I should say with the research study group. I think they signed on for not getting it for 2 years. And I think that will be hard to be considered palatable by people who view that they might have been in the control group, especially if they received the 2 shots and didn't have any side effects. So we'll vaccinate anybody. There's no harm in revaccinating them, even if they got it the first time. So that's to be determined by the person really themselves, whether they choose to show up or not.
Yeah, I think it's really no different than if you actually had COVID, right? If you had COVID, you had antibodies, you could be vaccinated. And I think there was actually guidance yesterday from the CDC about this exact question about if you got sick or if you had a or in a trial or whatever, how long would you have to wait before you could be vaccinated, Dana? And I think it was 3 months.
Yeah, they want you to wait, if you can push it out 2 to 3 months, absolutely. If you were in a study, please talk with your study coordinator. We know that studies, you can opt out at any time. That's part of essentially the Bill of Rights of somebody who participates, that volunteer part. Just as Secretary Norman said, there's not going to be any harm. We're fairly certain of that. These are fairly safe if we're talking about the Pfizer and Moderna one. But I think the best thing to do is start with your study coordinator for that information.
All right, and the second question behind that, I know the third one was about schools. So what was the second one, Taylor?
For people that live in long-term care facilities, since they're at the top of the list.
Turn it down. Guys, what do you think, Governor or Dr. Norman, what do you think of folks in a long-term care facility who turned down getting the vaccine?
Well, obviously, we would prefer that they not do that, but nobody will be forced to take this vaccine. I think probably the individual long-term care facilities would determine how to best deal with that. It may be setting up, a corridor for people who are not vaccinated and others who are. So I think we'll leave it to the long-term care facilities to figure out how to deal with that should that occur.
All right, and the third one was, are we going to, what do we think about schools reopening here for the next 6 months prior to vaccination?
That there was a plan laid out for schools to be able to open safely and conduct classes in school or with a combination of in school and some virtual. So there is a plan there that schools can implement when the positivity rate allows for that. They don't need to wait for the vaccines to come in and vaccinate the teachers, vaccinate the kids. They ought to be continuing to work off of the idea that they go back into the building when it is safe to do that. Obviously, the vaccine will make a huge difference when it is widely distributed to not only our teachers and other staff in the schools, but also our kids. I don't see that being a reality until the beginning of next school year at the earliest. But I don't think that should discourage our schools, school districts from figuring out ways to have kids and teachers come back into the school for in-person learning when the situation in their local district allows.
And Dr. Norman, the data I saw seems to suggest, and I know our data at KU demonstrated very clearly, that if people will wear masks and de-densify the campus and do some hybrid learning, the school environment is safe. It's not the school environment itself that's the problem. It's what happens after school or whatever. Thoughts about that?
Yeah, I agree, Steve. And as a matter of fact, we have probably one of the best studies on record right here in Kansas, published in the CDC Morbidity and Mortality Weekly Report just a couple of weeks ago, about 3 or 4 weeks ago now, I guess, demonstrating that mask counties early on way outperformed, decreased the number of cases actually, when the no mask counties went up over 100% in their case count. And we've talked about before, schools are not a safe island in an unsafe county or unsafe area. Masks work. As a matter of fact, this article that we published has been widely distributed worldwide, millions and millions of views on it. So I think it's becoming more and more clear all the time that this is the way to protect school kids and the teachers and staff as well.
And Dr. Ginther was on our program yesterday reviewing that same data. It's very clear how the importance of masking is. But those are those pillars again. Keep your distance, wear a mask, don't go out if you're sick, cough in your elbow, don't check your temperature, all those things.
Yeah, I think, that was an excellent study. That was a bigger study. There was a smaller study a few months prior to that looking at masking in Illinois when they made it mandates, and then on the other side of the river in Iowa, and they showed that when masking did happen, those counties in Illinois actually had an improved infection and hospitalization rate as well. And I think as far as we're talking about the schools, it's not just the kids, just as you talked about de-densifying, masking, distancing, but it's important for those adults in those schools to remember to do the same thing as well. Not eat in groups, not meet in large groups, and not have your mask on and not distance. So that's very important in the school building itself as well.
All right. Other reporter questions?
All right. Cody with Channel 9. Hi, everyone.
Hi, Cody.
2 questions as well. First one's a very quick logistical one. With the time sensitivity on getting the 2 shots, if you get 150,000 shots in Kansas by the end of the month, are you vaccinating 150,000 people with shot 1, or do you hold half of them and get 75,000 because you don't know what the next 3-4 weeks are going to bring? And then my second question will be after that for the governor and Dr. Norman. What is the biggest challenge right now in the rollout that you're seeing?
All right. First question. How many doses do we really have?
I'll take a whack at number one. That's 150,000 individuals. With a 3-week lag until dose number 2, then 150,000 more doses will come for those first 150,000. So it's not 150,000 divided by 2.
All right. And the second part of that question?
Well, let me give it real quick, and then I'm going to pass it over to Dr. Norman because this is his daily work. From my perspective, when I'm sitting in on meetings with Dr. Norman and our Department of Emergency Management, it would seem to me that just the logistics of distribution of the vaccine, particularly the Pfizer, because of the sort of short shelf life it has, the 5 days where you've got to get it out and into an arm. It just looks to me from a layperson's point of view that, coordinating all of those logistics would be the largest challenge. But I'm going to turn it over to a pro who can tell you from his perspective what he sees as the largest challenge.
Well, I've been called a lot of things, but pro. Appreciate that, Governor. Actually, the governor is becoming somewhat of a pro. She's has joined us on our incident command meetings, and it's important that she be there because we have to make important policy decisions. And I think that the biggest challenges are, one, logistics. And as the governor pointed out, the cold chain management with Pfizer is a particularly unique one that makes the pace have to be very attended to. And then secondly, is the prioritization schedule. We talked about essential workers in the springtime, but what we're working on now is the prioritization schedule, who gets it first, who gets it later. And it's different than it was in the springtime, because you ask yourself, a priority for what? And in this case, the priority is, one, to prevent people from getting illness, to prevent hospitalizations and prevent deaths. And so that will be a little bit different than what we saw in terms of essential workers in the springtime. So prioritization schedule is something else that we consider ourselves a lot with, and of the ethical considerations behind that also.
Yeah. All right. Other questions out there?
Hi.
Go ahead.
You all.
Okay, you're cutting out.
Oh, it's Shannon O'Brien with Fox 4. Can you hear me?
Yes, we can. Hi, Shannon. Mm-hmm.
Hi. I've got a few questions as well. I'll ask them one at a time. How do people who are not essential workers, who are not over the age of 65 and live in nursing homes, how does the regular public sign up to get a vaccine?
Secretary Norman or Governor Kelly?
Yeah, I'll take that. Those groups that I talked about Shannon, I would look regionally for those answers, because one of the things that we are very deliberately doing at the state level is pushing out vaccine with guidance to as broad of a number of people, of organizations who will immunize. And to do that, I think the best sources locally will be the local health department and FQHCs, Federally Qualified Health Centers, because they're pretty much all are participating as we've described. So I would look for local answers through your local health departments, because they're the ones that we deal with most of the time, quite honestly.
And I'm just going to say, I know the governor has to step out in just a moment. So Shannon, if you have questions for the governor, let's go to those first.
Well, my next question is, it's kind of following up on an earlier question. If people choose not to take the vaccine, because there's a lot of people that are hesitant. I know you guys talked about that yesterday. Are they going to miss their chance to get the vaccine since it's a 2-dose deal, or are they going to can they say in a couple of months after they are offered it, well, you know what, I changed my mind, I want to get the vaccine?
Again, I am not the medical professional. I would imagine that, yes, we would let them get into the queue when they're ready. I would expect that would make the most sense for not only that person, but also for us in our desire to get as many people vaccinated as possible. But I'm not sure that decision has been made. I'd have to defer to Dr. Norman what the internal and external advisory committees are talking about in terms of somebody who turns it down initially, but then comes back and says, yeah, I want it.
We will not turn down somebody that turns it away early on and then comes back and later on wants to get it. And, the data shows that about upwards to 15 to 20% of people are kind of what we call, quote unquote, riding the fence, wanting to see how this goes. We hope that they will take other precautions in the meantime, but we will vaccinate people if they choose not to get it early on, but would rather postpone it and get it later. We'll do that.
Governor Kelly, I know you have to head out to this morning. Is there any final thought that you would like to leave us? And first of all, thank you for your leadership and your work on this. It has been tireless. I know that. And for those of us in the front lines, we so appreciate that.
Absolutely.
And appreciate your advocacy for all the rules of infection control. You've been very consistent about that throughout. And can't tell you how much that's meant to us here on the front line. So thank you. Final thoughts that you might have?
Well, you are very welcome, Dr. Stites. As you well know, I live with a frontline worker, and I'm the mother of a frontline worker. So I take this very personally when it comes to all of you. But I would just like to encourage Kansans to stay with it. Keep your mask on, keep your distance. Please don't mass gather for the holidays, as hard as that will be to not. But to stick with it, because really, help is on the way. We can do this. We can beat this virus if we stick together. So just hang in there for a few more months, and we'll be on the other side of all of this. So thank you for the invitation to be here this morning.
You are welcome back anytime. And again, thank you for your leadership. It's been just very helpful for us that watch you and your team out there trying to work so hard for us. So thank you for that. I even have to say thank you for Lee Norman. I got to swallow when I do that. All right. Other questions out there? I know Dr. Norman's here till 8:35, so we have a few more minutes with him.
Hi, this is Ty with the Topeka Capital Journal. Can you hear me?
Yes, sir.
Cool. For Dr. Norman, I just have two questions. One, I wanted to ask, well, in terms of the distribution of the vaccine, is it urban areas that are being targeted first, or will rural areas and urban areas probably see around the same time? My second question is, some states like Tennessee have, are making like this backup vaccine supply. I'm wondering if Kansas has plans for maybe the same.
Let's first of all talk about the timing versus urban and rural.
Urban, rural. Yeah, we're covering all the areas, every one of 105 counties, right out of the chute, because the priority people for the first phase are in every county. So we have the plans to do that. There'll be more on a per capita basis, obviously, or I should say, just because they're larger in the 5 counties that have the largest population. But it's going to every county, urban and rural.
And the follow-up question, I think, was, are we having a backup supply? And if so, what are we going to do with that backup supply?
No, we have no intention to inventory or warehouse a backup supply. The reason is we aren't going to have enough vaccine anyway to go out as fast as we would like to through the state of Kansas or anywhere in the country. And it doesn't do any good in a bottle on a shelf. The only place the vaccine does good is when it's injected into people's arms. So we do not plan to have a backup supply, maybe someday in the future, but not between now and the summertime.
Yeah, I think what we need to back up is our antibody, and the only way to do that is to get the vaccine in the arm. So, all right. Other reporter questions.
Bob Cronkleton with the Star here. I had some questions about the Thanksgiving gatherings and kind of the impact that when you expect to see the impact of the gatherings, and then what people should be anticipating, and when will we be past that potential impact, and what you're able to glean from the impact as we head into the next holidays, including Christmas.
Well, Lee, I think both Dan and I will turn to both of you here in a moment, but I think it's a wave of impacts. It's not any single one point in time, because the dissemination of the spread continues with that ripple effect. So I think we're already seeing it. I don't think we're going to fully know what it is, and I actually think it's going to wash right into Christmas, so it's going to be hard to decipher. What are your thoughts?
Was that to me, Steve?
Yes, sir.
Ditto. Ditto. It's going to, if it were just from Thanksgiving and the weekend that follows, in theory, 14-day incubation period, it should be starting to tail off now. But people really, between Thanksgiving and Christmas, just start doing an uptick of everything, of shopping, of gatherings. So it's really a blur of a holiday and not a point on the calendar. So still, the admonishment is still the same, to be very cautious and minimize the mass gatherings. I think that we're going to be seeing the tail off of this all the way into mid-January.
That I would say that, because I think there's also that if you have more people who are positive, and they don't stay home, and they come in contact with more people who, then there's this thing where you can begin to build on itself and can almost become a logarithmic scale. So, Hawk, what do you thought?
Yeah, I would totally agree. You know, we thought that the Memorial Day stuff was going to be a huge wave and a huge effect. But when you look back, we didn't really see that until 6 or 8 weeks later. It wasn't just 2 weeks later or 10 days later, because it is that ripple effect of those other infections. And I don't think we're truly going to know until we, look back retrospectively and we look at those timeframes and those dates. We continue to hope and be optimistic that our hospital numbers will stay down. We know that there was a good dip in the overall numbers in the Kansas City metro area, but then that dip changed and then there were increases again. So I think it's just something that retrospectively you really won't know you won't know until you look back retrospectively and put those time points in. And otherwise it's just continuing to evaluate day by day, but the full picture is not known until you can look back.
Other reporter questions?
One follow-up question. With the vaccines arriving now, do you expect that to have any effect on people's attitudes or anything coming up to the Christmas holidays? Do you think people will relax?
Oh, I hope not. Otherwise, it won't. People are going to get ashes and switches for Christmas. So, Dr. Norman?
Yeah, I agree. And I'm sure Dr. Hawkinson would be happy to comment on what level of immunity, what level of antibody formation in a population are required to garner herd immunity. But we're not going to be anywhere close to that. Even if we said that 8 to 10% of our populace has already had a naturally occurring illness, and then we have 150,000 optimistically immunized by the end of the month, we are far, far from herd immunity. So we cannot let our guard down until we have a much significantly higher number of people that are immunized.
I agree 100%. This is behavioral at this point. We saw what happened when we came out from the stay-at-home orders. People, they thought it was done, and so they were able to go out and do things that they wanted. Now that the vaccine has just arrived and not even in people's arms, they're going to say, well, the vaccine's here, I can go out and do what I want without even getting vaccinated. And to Dr. Norman's point, certainly we know that, okay, maybe you have had antibodies or you've had the disease. Well, if you've had mild disease and you haven't even had to seek medical attention, not critical disease, we know that your antibodies, for what it's worth, your antibodies wane quicker than those patients who have had severe disease. So how durable is that immunity if you had slight symptoms for 2 or 3 days? We don't know that either. So, I think just having the vaccine arrive and distributed doesn't mean that the populace is immune or there's herd immunity. We need to make sure we take these weeks when the supplies get here and vaccinate as many people as possible.
Indeed. And I think what we have to remember is that the gift you unwrap under the tree should not have COVID-19 in it. So make sure you try and prevent and follow the pillars of infection control. Other questions from reporters?
Yeah, hi. This is John Shorman here with the Star. I'm curious if Dr. Norman can kind of address the current status of planning around distribution, equitable distribution of the vaccines, reaching minority communities, medically underserved communities, those kind of considerations, and any insight you can give into what the planning is like right now.
You bet. And Dr. Norman, we know that's important because so many essential workers are in that community.
Yeah, John, that's a great question. A lot of thought has been given to the, our governor made mention of the External Advisory Committee, and we have wide representation by tribal organizations, ethnic and racial minority groups, so different socioeconomic groups, and then beyond that, by faith leaders, medical bioethicists, and the like. We'll look at it with many sets of optics. When you look at different communities, also you can gain access through different kinds of employment settings, different kinds of transportation hubs and modes, because we know that people that of lower socioeconomic financial means tend to rely more on mass transit. This is exactly one of the reasons we've enlisted local health departments and FQHCs. I mean, right there, that's 140 different providers that very much target those at-risk populations. Also, we'll have mobile units that will go out to the communities rather than to have people necessarily come into a central site. So a lot of thought has been given to that, but nothing more important than involvement by those communities in a firsthand basis with our external advisories.
Other reporter questions?
I have one for KCUR that would I haven't heard asked yet.
Do you have one more time? Do you have time for one more question, Dr. Norman? I know you have to run pretty shortly.
Yeah, sure, I can do one more, Steve.
Okay, Thank you, sir.
Thank you. The question is, if I live in one state and my doctor is in another, where do I go to get the vaccine?
It's a great question.
The virus knows no state lines, and we don't either when it comes to that. And this is coming up a lot. You know, we have people that advisedly are not spend their winters in Scottsdale or something like that, and they're wondering if can they get an immunization in Arizona. Our systems are set up that we will vaccinate anybody who requests it, and then they will have a card that says what kind of vaccine they had. So when they go back to their home state or whatever, they will get the same. They should get the same vaccine back in their home state. So we won't respect the state line, especially when you think about KC Metro and those on the state line. It's impractical to think that we would ever say, go back to your home state. We won't immunize you here. We'll immunize you here.
All right, so good. Well, Dr. Norman, I just want to, I love to tease you because you're a good friend, but I also want to say thank you. You so appreciate your leadership and all that you've done and how hard you've worked for us and the hours you've spent, you and your team, and anything we can do, we're here to help. And any final thoughts you have for us today? Well,
thank you guys too, and this has been a really important communication tool for getting out high quality information. I've commented before that I never thought I'd say that the epidemiology and science of a pandemic is easier than anything, but it's easier than the social psychology aspects of this pandemic. If I ever get gray hair, it will be on having to convince people that 300,000 people have died from something that's actually real. I can't believe I'm still having to do that. And it drives me a little bit nutty, quite honestly. But nothing better for attacking the social psychology aspects than high quality, reputable, credible information. And you guys have done this steadfastly, so thank you very much for that.
We will hang in that and keep on message. Although it's the first time anybody ever said I was high quality, Lee. So I'll take that. Thank you for that.
Actually, I said the information was high quality.
Fair enough. Fair enough. I was trying to steal a compliment, Orban. Thanks a lot for that, brother.
Okay.
All right.
Bye, guys. See you.
Thanks, man. Jill, let's see what other reporter questions might be out there.
Okay.
Not hearing any. We've got a few minutes left. In the next 4 to 5 minutes, we'll try to answer a couple of community questions. How's that?
All right. Well, here's one that you guys probably.
Can I slide one more in?
You bet. Go
Yes.
right ahead.
Okay. So talking about the antibodies, going back to that conversation, for folks who have had COVID and still have a decent level of antibodies, because this vaccine is in such short supply right now, should those people hold off on getting the vaccine until it's more widely available, since they do have some form of protection?
What do you think, Hawk?
Yeah, so I think if we're talking about right now the first group of people that can be designated to get it, if you've had it, you can certainly wait, maybe 2 months, 3 months, but we don't know what a decent level of antibodies are, and we don't routinely check those. So if you've had the disease within the last 2 months, maybe even out to the last 3 months, you can elect to defer the vaccination until that time, because we know the supplies are so short. But if you're in that first group and you are in that 2 to 3 month range, we're probably still going to recommend that you get it. For the general public, especially if you've had mild or moderate disease and hadn't had to seek medical attention, you probably are going to have waning antibodies a little bit earlier than, say, someone who's been in the hospital with severe disease. So really, right now, the guidance for the CDC is, yes, you will need the vaccine. You should get the vaccine. But if you defer or decline to get that for 2 to 3 months until supply is built up, that is a reasonable action as well.
All right. Jill, a couple of questions. Then I do want to have the chance for Hawkeye to talk a little bit about the Moderna vaccine, which we haven't done yet.
Right. Okay. People with autoimmune diseases are told to do things to minimize their immune response. Should they take the vaccine?
Actually, great guidance from the CDC again yesterday. It's a little bit of a decision that you can make on your own, but in general, the answer is yes, you need to take the vaccine.
Yes, you should take the vaccine. Make sure that you talk with your healthcare providers. Again, this vaccine looks to be, very safe so far. And again, we're talking about Pfizer and potentially Moderna once the EUA is released. These look to be very safe. They're just pieces of the virus. They're not the virus, so you aren't going to get ill from this vaccine. You should take it. The big question is, depending on how much immune suppression you are on and what immune suppression you're on, will the vaccine take? Will you be able to get immunity from it? But if you are on those drugs, you probably have medical professionals that you talk with and confer with. So talk with them. But probably the bottom line is, yes, it probably is going to be recommended that you get it.
One more question, then we got to talk a little bit about Moderna.
Okay, I'm trying to find one that is more related to the COVID. Just, I guess, a general one would be, going back to messaging, people that are vaccine hesitant, how would you convince them to go ahead and get the vaccine?
Hawk, I think it's about information and time. I think we heard yesterday from both Dr. Ginther and Dr. Bricker that really, with the vaccine hesitant people, they're not saying no, they're just saying, I want to wait and see. And in fairness to people, you've only been able to start really seeing data in the last week. The FDA pushed all the Pfizer data out there, and I assume it's going to be pushing they just did their preliminary review yesterday on Moderna and got that out, or this morning and got that out there. So we're starting to see all the data from both of those trials. I think the data will show it to us, and then I suspect a lot of people want to see how it goes when it's out in the general public, and they'll be convinced with time as people do well. I think we'll see very, very rapidly that those who are getting the vaccine don't get COVID-19, and those who don't get the vaccine will. I think that's going to convince a lot of folks.
Yeah, and especially will and have that propensity to go on to severe and critical illness. So again, we think the hesitancy is fine, but make sure that you do your due diligence and get that information, that accurate information. Look at those studies. If you're unable to look at those studies, talk with your physicians, talk to a trusted source, look at the CDC website, look at your local health department website, because that information is out there. You talked about New England Journal of Medicine, and all of those COVID-19 articles are free for public use as well. So if you're hesitant, that's fine. There's nothing wrong with that. But make sure you're also on the other end of that, doing your due diligence to read and understand the science behind it.
And I would say if you're worried that we're trying to rush things through, remember that the Pfizer and the Moderna vaccine data look great. AstraZeneca's had a few stumbles, and so that one's going to have to get more data. Johnson & Johnson isn't doing as well, and so they're going to have to go get more information, or maybe even reformulate their vaccine a little bit. So when you look at the information regarding those, do beware that people are judging these and making sure that the things that are working and safe come out, and those that don't are not. And so if you have any doubt about that, just look at what's happening around you. People are tapping the brakes around AstraZeneca and J&J. They're hitting the accelerator on Moderna and Pfizer, and that's because that's what the data tells us is so. So let's talk a little bit about Moderna. It looks really almost identical in terms of its success to the Pfizer data. I mean, it was 94 or 95. That's really the same number.
Yep. Yeah, and it's essentially, similar types of vaccine. You have these lipid nanoparticles, and then the RNA inside, that is what gets injected into your muscle, taken up by your muscle cells and other cells as well that then present it to your immune system to build that immunity, and that's B cell and T cell immunity. But it looks like the efficacy is just the same, essentially the same. Hopefully it'll be safe. They have a new, I think they have a new 54-page brief that is available. I haven't been able to look at it yet, but they look essentially equivalent. And so, that is good news. We still need to look at the final presentation and the final data, but really, I think we are really optimistic now, because now we have two really similar vaccines that are going to be able to be rolled out. That will increase our supplies. That will increase our ability to get it out to everybody that needs it.
All right. Tomorrow, Stacy Kimyu, who is a COVID-19 survivor, will be joining us, talking to us about believing in the power of masks. She didn't necessarily believe in mask wearing until the 50-year-old came down with COVID-19 and was on a ventilator. She'll share what she has learned and why she now believes in that power of masks. Hawk, final thoughts from today.
You know, I think Governor Kelly was right on point with one of her initial comments, and that is about essential workers. We want to get it out to the essential workers. And then it was followed up by you when talking about we understand and know that the essential workers, not only in the hospital, but out in the community, are in some of those hardest hit demographics. And we need to get it out to those minority populations because they have been so hard hit. And we are working diligently here at the health system. And I know that the state is working diligently to get out all those supplies and all those vaccines when they become available to those communities so that we can get everybody vaccinated. Everybody is essential. We know that, and we are working on it day by day. It is a huge priority for us as well.
You know, we have been playing offense for all of about 24 hours or less, but truly, we have been building that offense for months and months and months. We've been on the defensive, and the defense, we know it does work. The power of wearing a mask, the power of keeping your distance, the power of washing your hands. And we see it every day in the hospital because the people who are taking care of COVID-19 patients here don't get COVID-19, and they don't in other hospitals where people are following the rules of infection control. So when you go to that Christmas tree or you're celebrating Hanukkah or whatever other things you want to do, remember that the power is still with you because you have the ability to follow the rules of infection control. Don't let that go. Don't get cocky just because finally it's really going to be game on for our offense. So whether you're on the prairie of Kansas or the Flint Hills or the Great Plains, the Ozarks in Missouri or the northern rolling farmland up in northern Missouri, or whether you're in the Missouri River Valley, the Kansas River Valley, the Mississippi River Valley, for our bi-state area, it is going to be game on. And you know who just came in to play quarterback with Moderna and COVID? Yeah, that's right, Patrick Mahomes. That's what we've got going on. So follow the rules of infection control because we're coming back and we're coming back strong. Game on. Be with us, stay safe. Remember, there's still no place like home. We'll see you tomorrow.